Hi everyone, and welcome back to my platform. Today I have with me Parth Kalia. Parth is a US trained counselor and is currently teaching psychology at the Symbiosis School for Liberal Arts. I've had the pleasure of working with Parth. He is an old colleague and a friend, and I'm really excited to have you here today, Parth.
So glad we're doing these things and like talking about really important stuff here. I'm really happy that I get this chance to chat with like a dear friend and colleague. So yeah, let's get this underway. I'm super excited to talk about this.
Great. So, Parth today is going to talk to us a little bit about self harm. Parth, I'm going to dive right in with my first question. Um, what constitutes self harm, and how do we see it presenting itself?
Many people often confuse self-harm with suicidality. Now, self-harm, if I had to give it as clear a technical definition as I can, I would say it would be the willful injury of oneself with the goal towards coping rather than an attempt to end one's life. Now, this is a pretty common confusion because, for the untrained observer, you're seeing someone basically attempting to harm themselves, and that way it's exactly what it sounds like. The distinction here being it is a means to cope, it is a means to escape from whatever difficult current reality they're working with, and it is not actually an attempt to end their life, but rather to make their living more tolerable or more manageable in some way, emotionally, that is. So yeah, that is a brief sort of intro from a technical perspective of what we might define it as professionals. In layperson speak, what it can actually look like, the manifestations of it are pretty varied. Manifestations could be, pretty straightforward. It could be cutting, it could be, other ways of self-injury like burning and things like that. One interesting thing that we see, and one thing that I've personally seen, and this is anecdotal, so take it with a grain of salt. But what I've seen is that sometimes in young men, it can very often present in over exercising, right, where there's a lot of physical pain involved in exercise to the point where it is more damage to the muscles. But it is not exercise done with the goal of fitness, although these individuals are very often fit. It is done more often with the goal of causing pain.
Glad you brought that up because something that I want to touch upon today is men's mental health because that's something I feel isn't really spoken about. We do see self harm manifesting with men very differently to the way we see it manifesting with women. And do you feel that that's got to do with the way we've conditioned men to cope with their emotions or not cope with them at all?
We are, in sort of a patriarchal society and looking at sort of the structures that we have put in place around things like gender and gender identity, then guys are not traditionally expected to express emotion. We're not traditionally taught to express even affection for that matter. So yeah, that absolutely comes in the way of finding productive coping skills because you're not allowed to show that this is being done to cope, right? So what you're left with things that very often might look nothing like self-harm to an outside observer, but you know that that's perhaps where you're coming from. So the exercise example is one. There could be other examples of like recklessly stimulating activities as well, which could come close to that, right? And some certain readings of it from client to client, you can tell that this is something that is being done with the intention to sort of self-harm, even though it doesn't quite look like that, right? The expectation of the hope is that of pain or of physical stimulation in some way. So yeah, absolutely. I think if I had to put down the things that really contribute to that, it's a lot of sort of societal structures that are in place. We don't really talk about these things. And while we are content to talk about, mental health, it's almost always framed in I'm not saying it's framed in a sort of a gendered way, but it's always that very positive, bubbly kind of thing. It's not something that, when you see these posts on Instagram about mental health, you're like, this probably was not catered to like a male audience in any shape or form, which is a strange thing to say, but I mean, if you look for it, you'll probably notice that it's there, right? So it just doesn't fall into what our expectations of frequently our upbringings have kind of taught us in terms of mental health, especially for mental health. So yeah, absolutely there.
Great. I'm going to go into my next question, which has to do more with the modes of treatment and management for self harm. And I remember that you're someone who kind of introduced us when we were working to working together to the concept of dialectical behavior therapy, which
Yep.
is a big part of working with self harm. So, could you talk a little bit more about that?
Absolutely. So, full disclaimer first, I'm not someone who's certified in, dialectical behavior therapy. I don't have the letters after my name and all of that. That said, I've worked with other practitioners and been taught by other practitioners sort of on the fly, as, many of us have. But dialectical behavior therapy is essentially sort of a all-around team-based approach when it comes to working with self-harm. And particularly for a little bit of history, it was designed with a very specific disorder in mind. It was designed kind of with borderline personality disorder in mind, which is where you see a lot of self-harm. In fact, self-harm is, if I'm not mistaken, one of the diagnostic criteria for BPD. Um, so when we look at that, it is basically a theory that is very skills oriented. It is trying to teach you very, very specific ways to cope and trying to reinforce that as a matter of sort of habit or second nature that I'm going to go and reach for my productive, useful, helpful coping skills rather than my unproductive or maladaptive coping skills, right? So it also teaches a lot of other skills. It frequently goes now because we see borderline personality disorder as being predominantly the place where there is self-harm. That does not mean that that is the only place where there is self-harm, right? It could be there with cases of anxiety as well, or even in depression in some cases. But because it is designed around that, some of the other things in DBT also cater very specifically to the concerns of those who have borderline personality disorder. So, for example, emotional dysregulation, a very heightened emotion, right? So everything is very, very intense. Very black and white relationship. So it tries and teaches middle ground by just reinforcing the statements, by reinforcing the action. Basically, it is very, very approachable. It does not require the clients to have perhaps like a very high level of insight into why they are doing the things that they are. It just requires them to do something different. And it's very much oriented around the doing. And when I say it's like a all-around approach, it is in its proper form when it is done with full, with all the right kinds of professionals, with all the right kind of professional setup. It is done in group as well as individual therapy at the same time. It is done with a lot of homework. There's a huge emphasis on here's what you're going to try this week. There's a huge emphasis on contracting, a contract between the client and the counselor saying, the client saying, okay, I will agree not to harm myself while I'm in therapy with you. And the counselor agreeing, well, okay, if you agree to that, then I will help you find ways where you don't need to harm yourself, right? Which is sort of the basic contract, but there's also much more specific ones, right? There's clients agreeing to say, okay, if I'm going to self harm, I'm going to contract that I will call my therapist instead, or I will try this other thing instead. In that way, they also have DBT teams, right? So it's not an all-around approach even at the client end, it's also on the therapist end because DBT counselors, again, at their best form, work in teams. They operate in groups who are aware of each other's clients. They're giving each other sort of constant supervision. you know they're involved in groups, and the people who are running the groups are talking to the people who are running the individual sessions. There's a lot of overlap in communication and collaboration when it comes to DBT teams. Essentially, when you're trained, you're made a part of a team, and getting to know your colleagues is also a big part of that. So that is like a snapshot of what DBT actually is. Again, it may not be the best snapshot because again, this is not something I'm certified in, but the takeaway from this, from the client's perspective, is that it's going to be something that's very hands-on in that it gives you specific things to do. So you can expect that out of someone who's, let's say, a DBT practitioner. And, dialectical behavior therapy, behavior is right in there in the middle of it, so it's very behaviorally oriented. It does not require you perhaps to go into, let's say, trauma, go into your past quite so much as perhaps other theories might. Right? It's not to say that you won't talk about your history. It's not to say that you won't talk about your trauma, but it will not require you to dwell on that trauma perhaps in a way that some of the other kinds of therapy would. So yeah, that's DBT at a glance.
Why does group therapy work well with clients who have the urge or tendency to harm themselves or hurt themselves?
That is a really good question. So one thing about group therapy is that when well, okay, this is sort of peeking behind the curtain a little bit, but when therapists put together, a closed therapy group, and when I say a closed group, I mean a group where, members are selected at the start and those members are consistent for a period of time. And it's not like a self-help group where anyone can come and go whichever part of the week they're in, when we talk about DBT groups, they're more oriented often around like almost like a syllabus, that we're going to talk about these things in group. And there's like a set agenda, and there's also a set composition. You choose which people are going to be in your therapy groups very carefully, so that they can sort of vibe off each other. They can get ideas and inspirations from each other. They can learn coping from each other. The thing that groups really help with, and this is probably true of any kind of group, not just a self-help group or a self-harm group, but the good thing about groups is that you're able to talk to people who genuinely have real shared life experience, right? Even as therapists, we aspire to be empathetic, but if you were 100% empathetic, that wouldn't really be possible, right? But that is kind of what you're very often getting in like a self-help group or any kind of group setting, frankly, is that you're saying, well, okay, I self-harm. How do you know what that feels like? There's a question that a client might ask a therapist, but when they talk to another client who's already there, they're like, you know what, this person really does get it. They really have walked the walk and they really are talking the talk. And what you can do is not what you can do, but rather what is frequently done is there'll be clients who are at different stages in their journey, right? Of different stages of learning not to self harm. And what they see can be inspiring in the sense that, okay, this other person who I'm seeing sitting right here next to me has started off where I was, but they are now doing better. Therefore, I can also do that. It is attainable. It makes things much more grounded and realistic in that way. And also, again, people do innately have kind of this thing to help each other, right? And what you will see is that even in the act of helping somebody else, you'll find some kind of fulfillment. In the same way, those in group, when they reach out to each other, when they connect, when they're connecting over especially these difficult things, that can also be therapeutic for them, right? In the coming to someone else's help or coming to someone else's support can also be meaningful for them. So it just creates a space where you can have all of these interactions, which isn't to say that it can't go wrong sometimes, but that is where you have a facilitator step in and sort of manage these things. These are not just unmanaged, sit in a room and talk about stuff. It's very structured, in fact, with DBT, in that there are specific homeworks, the specific stuff that you come into session in like a group session to talk about. So yeah, these are all the like potentially good interactions that come out of group. And the good thing is that you do group in conjunction with individual therapy. So, you're able to see each person's individual processing of what has happened in group or what they've talked about or what they've observed from the other members of the group.
What are some of the things that perhaps you, as a therapist, as a counselor, would like to give, the advice that you'd like to give the people who know of someone who's harming themselves?
Sure. So there's a couple of things, right? One thing that we kind of talk about in some cases, is how do we, and this is sort of a big question, particularly in India, right? Because as we know in India, there's not enough mental health practitioners to go around everywhere, right? There's a struggle that we have is how do we empower people to care for their own communities, care for their own families, care for the people next to them and their neighbors? Because let's be real, sometimes a therapist is not a possibility, right? So I'm really glad you asked that question because self harm is something that is a major taboo, even among mental health. It can often be seen as in certain circles, you can even be kind of fashionable, say, oh, yeah, I'm depressed or I'm anxious. No one sort of puts a positive spin on, oh, I'm self harming. You never see that come up, right? And there's a reason for that. It's because it is still, even among mental health issues, like it is still taboo. So if at all you do find out, the first reactions can actually be really, really important. So if you as a observer, as a friend, as a family member realize that hey, somebody close to me is, self-harming. I'm seeing scars, I'm seeing burn marks, I'm seeing something that concerns me. The first thing you can do is not to react. You have to respond rather than react. And that means sometimes just listening or just letting them know that like, hey, you can come up and talk to me, but I'm seeing this and I'm a little worried. Like, can you tell me what's going on? Right? Rather than the oh my god, why did you, right? The first reaction is always to kind of find out why, and the why is perhaps not, maybe the most important thing in the moment. Maybe the most important thing in the moment is how are you feeling right now, right? A big part of that is like trying to understand it, and the thing is understanding it is your need, not the need of the person who's actually doing the self-harming, right? And that's a big chunk of that is just putting what your needs in the situation are on the shelf for a little while. I mean, as people are kind of motivated to do that whole thing, where we're like, okay, I need to know because now I'm anxious and now you are making me anxious. They're not making you anxious. No one is doing this with an attempt to make you feel worse. This isn't about you, in fact. But, and I think that needs to be said. It sounds facetious, and I apologize for that. But I mean, it does need to be said that mental health is not really about the people observing it sometimes. So the best thing you can do is keep an open mind and not to panic, because that first reaction of panic, when the first thing you say is, "Oh my God," then that person immediately, the first reaction can often be, "Okay, I don't want to burden this person with more information. I don't want to tell them more because clearly they can't handle this." Clearly, like, their first reaction was to panic. So their first reaction is to panic. I don't want to cause them more of a discomfort or more of a burden. I already maybe feel like a burden anyway. So I'm just not going to talk about it. It's easier to hide it than to sit and have that lengthy conversation. Or if you make it like an interrogation, right? If you just keep questioning, then the response can be, okay, I was already self-harming and now I'm being interrogated. Like, why would I want to keep talking about this? It's easier to lie, right? What you're trying to do essentially is to remove as many obstacles to that hiding process, or that need to hide. You're trying to eliminate the need to hide that there is something wrong, right? And that is difficult because we're all very, very heavily conditioned to not talk about these things and not show them off in public or anything like that. The best thing you can do is breathe, mind your own reactions, ground yourself, and just listen patiently. Ask a few questions that you really need answered. One thing I will say is, just given my background in crisis work and dealing with emergencies, sometimes you do also have to ask uncomfortable questions like, hey, do you need to go to the hospital right now? Do you need medical attention? Right? A thing that can very often happen is that when you start self-harming, people don't really go and look on like guides on how to self-harm. And sometimes someone might be intending to self-harm but might end up seriously injuring themselves in the process. If you feel like that's a risk, if you feel like there's infections or anything like that happening because of cutting, for example, or if there's some lasting damage that's happening, then medical attention is called for. And while it sucks, if you have any potential idea that this person is a serious danger to themselves right now, where there's a threat to their life, then that's perhaps where you have to maybe put that confidentiality and put that privacy on hold just to make sure that they stay alive, right? So again, this can be worrying, but keep in mind that the person is not maybe trying to kill themselves. This is, if it is self-harm, then it is not suicide. And if that's the case, they're still trying to stay alive. You're just there to help that process along, right? They're still trying. So yeah, those are the basics of it. I would say always, if you can, find a professional. It's understandable that not everybody is trained to kind of deal with this, because guess what? You weren't expected to be trained to deal with this. There are people who have been trained to do this. Reach out to them, right, as soon as you can. There's a number of sort of hotlines as well as like professionals wherever you are. And because everything is basically online right now, you can now shop for a mental health professional any way you want, basically, so get the best one that you can. Yeah, that's my summary of it. There's more nitty gritties in there, and for anyone who's interested, you can probably look up things like the QPR model, a question, persuade, refer model. It's a way of getting people assistance for suicidality, but it also applies pretty well to this. You know, so a lot of resources out there, but these are the basics. Just keep yourself grounded because you're going to be there as an anchor for somebody else.
I often see family, primarily family and then
Yes,
friends coming in
particularly family.
absolutely
Yeah,
panicked, worried, blaming themselves because they think it has to do with them. But and that's
yeah.
something we need to keep reminding people is that someone else's mental health isn't about you. So that's going to bring me to my last question now, Parth. Question to you is, Parth, and something that you would like to share with the audience that's watching. What do you do for self care, and how do you look after your own mental health?
I'm glad you asked that. Me personally, I keep myself buried in my hobbies. I mean, I'm someone who has something of a, let's say, a shorter attention span than most, so I have a lot of hobbies which I can sort of cycle around and come back to. So I think pretty much within sight line, I can see some brush pens over there. There's a ukulele over there. There's some board games over there. There's a few unread messages from my friends. Like, so there's always, I try and keep actively, rather making the time very actively keeping people in my life that I can. Staying in touch is a big one. And hobbies. Like for me, it's hobbies. For me, it's something that can occupy my time. For me, it's reading. There's two unread books right next to my bed over here. So keeping these things within arm's reach, keeping these things, stuff that I do daily is important. And I think the one thing that I would say to anybody, right, self-care isn't something that you get time for, it's something that you make time for. You have as much time for it as you decide to make for it. And guess and I mean, guess what? Like, if your cup is empty, you're not going to help anybody fill up theirs, right? This is one of those situations where, particularly given the world situation right now, like turning on the news these days is more a game of like, well, what's happened today? What bad news are we getting today, right? So when you have that, take some time away, take some time to even isolate if you need to. For some people, they feel better by isolating. For others, they feel better by reaching out. But whatever it is, if you need to do, make the time for it. It's not easy to come up with like an exhaustive list of like what self-care is and what self-care means to everyone. For some people, self-care is something that puts a smile on your face. For others, it's doing something that you might not enjoy but is meaningful to you. For others, self-care is losing yourself in a hobby or losing yourself in a sensation for a little while. So while I can't tell you what kind of self-care will work for you, I would say give everything a try once, right? You're only going to figure it out by experimenting and trying to see what helps you cope. And also just make the time for it and make it consistent. Make self-care a habit, right? You get up in the morning, you take a shower, you have breakfast, you have your cup of coffee, then take your time for self-care. Make that as much a part of the routine as anything else. That's what I got on that one.
It's been great chatting with you, Parth. I think this has been extremely delightful and, more importantly, insightful. Uh, you've
Glad
helped
I could be on.
you've helped me give more perspective on self harm, which I think was required. And like you said, it's a taboo topic. It's a taboo mental health concern, and which is why I feel we need to talk more about it.
Yeah,
Um,
absolutely.
so I look forward to having you here again to discuss something else that might be taboo or not. And
I'd
thank
be
you
happy to.
so much for taking out the time, Parth. Really, thanks a lot.
I'm so glad I could do this. I'm so glad you're doing this whole series. Like, I'm sure it's going to be really helpful for people watching to, demystify some of it because, like you said, it's not something we talk about. It's something we should absolutely talk about. Not even because it's like super prevalent, perhaps, but because for the people for whom it is a reality, it is a very difficult one. So, if this reaches someone, who is dealing with this or has a loved one who's dealing with this, I'm glad you took the time to make this. I'm sure that actually will be helpful. And yes, of course, I would love to do more of these with you anytime. Just reach out with right here.